Thank you, Governor. Hello, everyone. It's great to be back with you, along with my colleague, Director Smiley. Before getting going, I also want to say thank you. I received well wishes from many people after testing positive almost 2 weeks ago. Thankfully, I never experienced any symptoms, and by getting tested regularly, now and going forward, I was able to effectively protect my household. I was able to identify that I was positive and ensure that no one else around me has tested positive since then because of that level of information we were able to have. So I was very touched by everyone's kind thoughts and want to express appreciation. So to jump in, I want to hit on 3 main topics. These are the tools that are going to take us through to the end of this pandemic: vaccinations and testing and treatment. We're continuing to do very well on the vaccination front. As people probably saw in the news, the FDA has authorized the use of COVID-19 vaccine developed by the company Moderna. This was after doing the same extensive weeks-long review of all the safety and efficacy data on the Moderna vaccine that was done on the PFIZER vaccine. What was involved includes reviewing thousands and thousands of pages of technical data on the vaccine's clinical trials and on the manufacturing process for the vaccine. There were no safety concerns identified, and the data are indicating that the Moderna vaccine, like the PFIZER vaccine, is remarkably effective. It has a 95% effectiveness rate, which is incredible for a vaccine. Thankfully, also, we have an expert panel in our Rhode Island COVID-19 vaccine subcommittee. I want to say thank you to all of them for their commitment, emergency meetings, reviewing the data, asking good questions, really making sure that we're doing what's right for Rhode Islanders. That subcommittee has determined that the safety review at the federal level was sound and recommended that we use this vaccine, the Moderna one, in addition to the PFIZER vaccine. We expect 19,000 doses of Moderna vaccine to come into Rhode Island this week. 11,700 doses are coming into Rhode Island just today alone, which is very exciting. And by the end of the week, 35,000 doses should have come into Rhode Island from both PFIZER and Moderna. That includes roughly 5,000 doses set aside for vaccinating in our nursing homes, which is scheduled to begin just after Christmas. All through next week, when we're doing a lot of vaccinating in nursing homes, we expect our doses administered numbers to rise quickly. As of 9 a.m. this morning, as the governor shared, 6,400 first doses of COVID-19 vaccine have been administered in Rhode Island. We are in the last stages of finalizing our COVID-19 vaccination scheme. We shared the early form of it a couple of weeks ago. It's not going to change from that high-level view, but we're getting to the level of detail that we have in Rhode Island in terms of how we're going to distribute it so we can continue to be as effective as possible. And we'll lay out the order in which vaccine will be available to different groups in Rhode Island in the coming days. While we're making some final determinations about some very specific groups, as I mentioned, generally people won't be surprised by the final plan. We've described our approach in broad strokes, explaining that Rhode Island will be vaccinating people based on their risk level, and we will continue to maintain a focus on equity. That's why, as Dr. Chan said last week, we are finalizing plans to vaccinate in Central Falls early on in the vaccination campaign, and we'll move on to the other zip codes and communities that are hardest hit as well. Even within our hospitals where vaccinating is happening now, our expectation is that equity will be the guiding principle. One last note to say about vaccinations is we have not seen anything of concern locally, but there have been warnings about scams issued in other parts of the country. So we want to make sure that you're aware of that. No one will have to pay for vaccine out of pocket, and there is no list to get on to get vaccinated. If someone contacts you asking for financial information related to COVID vaccine, do not provide it. Okay, so the next topic I want to address is testing and treatment. Both of those go together in a package. Dr. McDonald shared last week, as physicians, when you look at tests, you want to be able to do something with it. What information are we going to take from that so that we can handle things differently? And we want to make sure that everyone knows about the treatment options that are available. We're ramping up testing. We want to ramp up the treatment access to that at the same time. To start with the testing, as the governor's been sharing, we really want people to be tested. Testing is how we can get people to understand or know if they're positive, particularly if they don't have symptoms. I'm now the poster child for being able to do that, so that then you can make the changes you need to effectively protect your household. Stay in isolation, keep other people from receiving invisible spread of COVID-19. Testing is an excellent tool to be able to do that. We really want to encourage everyone to not only do testing, whether or not you have symptoms now, that's what we have expanded to. Even if you do not have symptoms, you should get tested, and also get tested regularly. You can do it up to every week, going and getting tested to get into that rhythm. That's a major tool to be able to protect the people in your household. To that end, we saw a lot of demand at the testing pop-up sites that we've held over the last few days. We've said we're going to take those steps to reach you where you are, and people are responding. I want to take a moment to clarify what these sites are for and what they're not for. Pop-up testing sites are about meeting people where they are. For example, if someone is already at the Warwick Mall, we want them to be able to get tested there. If someone is visiting another area, we want you to be able to have testing accessible to you while you are already there. If you're at Chapel View shopping already and have a few extra minutes to get tested, go do that. However, pop-up testing sites are not intended to be places where people should be going specifically to get tested. We already have tons of resources in places for that. If your sole aim is to go get tested, which is what we want everyone to do on a regular basis, the best thing to do is to make an appointment through PORTAL.RI.GOV. The team has worked extremely hard to make that accessible, to make it easy. There was a time when you needed to wait days if you wanted to get tested through portal.ri.gov. It's important to know that's not the case anymore. This is a way to avoid long lines for waiting. You can just go on to the portal, schedule your test, know where you'll go in, get the test, and get out. We have invested an enormous amount of energy into building out our testing infrastructure. We have same-day appointments available every day at sites all throughout Rhode Island. You log in, you submit some information, then head to a testing site near you later that day, and you're in and you're out very quickly. No waiting, no lines, and no costs. It's free. Please take advantage of this. Going through portal.ri.gov is the fastest, easiest, most convenient way to get tested. And we want to continue to encourage that. This is a key tool to protecting your household the same way I did. At some of our sites, such as the Dunkin' Donuts Center, you'll have your result before you leave in 15 minutes. We have thousands of slots at the Dunk every day, and there is free parking in the North Garage. We want to continue to expand and make that accessible to you. We want to make sure that you take advantage of it. When you think about the fact that COVID-19 spreads very easily, and when you think about the fact that some people are very vulnerable to this virus, it's pretty clear that getting tested and then being able to change your behavior if you're positive by going into isolation, protecting your household, keeping other people from getting infected, you then have the power to save a life. Particularly if you don't have symptoms and don't know that you're positive and there's risk for invisible spread happening to someone who could be at risk of a challenge because they develop symptoms or have underlying illness or they're a senior. Let's take that power into your own hands to save a life. Getting tested helps protect your household, your colleagues, your friends, the people that you love. We talk a lot about protecting your household. Getting tested regularly is that concrete way to do it. In addition to protecting your household, getting tested regularly can help you when it comes to COVID-19. That gets into the second part of what goes along with testing, treatment. Last week, Dr. McDonald talked about something called monoclonal antibodies. This is a treatment for COVID-19 that you get via an intravenous infusion. It's quick, it takes about an hour, and it is very effective. The whole goal is to keep people out of the hospital. It's intended before you even have to go into the hospital. People are describing it as miraculous. In order to keep people out of the hospital, you need to start this treatment early on in the course of your illness. It's not as effective if you start it a long time after you've been exposed and have been identified as positive. Getting tested regularly and knowing early on if you are positive is a way to make sure that this treatment can be an option for you. We're working hard to make sure that the treatment is available in as many different places as possible, in nursing homes. We want to build it out at testing sites. We have providers who are ready to work with you to get connected to treatment. Please look into that. It is an option that's available for you. So the three things I've talked about today, vaccinations, regular testing, and treatment, are the tools that will see us through to the end of this pandemic. These are the key ways that we are able to protect our household as we get through the rest of this pandemic. If we can stay vigilant and stay focused on the things that will have the greatest impact, vaccinations, testing, treatment, wearing your mask, staying with your household, keeping them protected, that's what's going to get us through this as quickly and as safely as possible. Before finishing and opening up for questions, I want to echo some of the gratitude that the governor expressed. It's hard to put into words the amount of appreciation that you can have being connected to such a large group of people who are committed and working so hard to make sure that Rhode Islanders are cared for. The governor mentioned Adam and Christopher at RIDO's State Health Laboratories and so many other individuals at our other state agencies. These are just a few examples of the dozens and hundreds of people throughout public service who have been doing heroic work. The sacrifices people have been making have been tremendous. I am truly humbled and honored every day to be a part of our entire statewide response team and a proud member of our Rhode Island Department of Health as well. I also know that everyone throughout Rhode Island has been making tremendous sacrifices over these last 9 months. We all know that this has not been easy. It's probably an understatement. For many of you, it's been the most challenging year of your life. I want to echo what has been stated in truly thanking you for your patience and your partnership and your commitment to protecting those around you and those that you love. I'd like to wish a Merry Christmas and a Happy Kwanzaa to everyone who celebrates, and I hope everyone had a Happy Hanukkah if you celebrated Hanukkah as well. Please remember, keep any gatherings just to the people you live with, pick up the phone or connect virtually to share your love and your gratitude and your warmth this year. And please remember those people who, for one reason or another, might be feeling a little more alone this year. I wish you all health, happiness, and blessings in the month and years to come.